Good afternoon, everyone. My name is Kelsey Heindel, and I'm a program coordinator in the MCW Office of Community Engagement. And we welcome you to the April edition of our monthly Community Engagement Spotlight Series. Please note that this session is being recorded. I'd first like to begin with a statement from the Office of Community Engagement. We wish to acknowledge the Indigenous people who are past and present stewards of the land on which we pursue our just cause of a healthy community for everyone. To our audience members, please be sure that you are muted throughout the presentation, and we encourage everyone to use the chat bar freely to share comments or post questions for our guests. We will be monitoring those throughout the session, so feel free to send them as they come to you, and we will address them throughout. Please look for information about upcoming guests on our community engagement website. You can find our series by Googling the webpage MCW Spotlight. This monthly series features community partners and the important work they are doing for and with the community. We highlight their goals, motivations, and accomplishments and the ways they have partnered with people and programs at MCW. This month's Spotlight is highlighting an MCW-Central Wisconsin partnership, and we are so grateful to have team members from the Advocates in Medicine Pathway program joining us today. At this time, I would like to introduce our Senior Associate Dean for Community Engagement, Dr. Stacy Young, who will say a few words about the work of the Advocates in Medicine Pathway Program team and introduce our guests. Dr. Young.
Thank you, Kelsey. The Advocates in Medicine Pathway Program, also known as AMP, supports the professional development of individuals from Wisconsin interested in attending medical school at the Medical College of Wisconsin, Central Wisconsin campus. This program works to promote a diverse future healthcare workforce built around resilience, relationships, and system-based knowledge. The current program cohort started in January of 2023 and will run through July of 2023. During the semester, students attend a virtual one-credit course entitled Wicked Problems in Medicine, and they also participate in virtual advising sessions in the evening. A clinical coordinator works with the students to arrange a one-week job shadow opportunity, which is community-based experiential learning and that fits their needs and interests. From June to July, the cohort participates in the Wisconsin Area Health Education Center Community Health Internship Program as full-time paid interns. Now, a little bit about each of the AMP program guests joining us today. Emma Ceaglske is one of two near-peer mentors in the AMP program and is a graduate of one of its 2022 cohorts. In December of 2021, she graduated with her bachelor's degree in biology from the University of Wisconsin-Eau Claire and is currently applying to medical school and working as an emergency department tech in a rural emergency room in central Wisconsin. Sheng Khang joined North Central Area Health Education Center as the Education and Outreach Coordinator in the summer of 2020 to coordinate the pre-med pipeline AMP program. She has a Bachelor of Science in Healthcare Administration from the University of Wisconsin-Stevens Point. Sheng has lived in central Wisconsin since 1993, has over 7 years of experience in education, and has over 5 years of experience in a healthcare setting. Paul Whitaker is a professor of biology at the University of Wisconsin-Stevens Point, based on the Wausau campus. He teaches a course called Wicked Problems in Medicine, which is a component of the AMP program. The course is also open to other students, other interested UW-Stevens Point students. Norcy Pina is a Community Resources Coordinator with CAP Services Incorporated. CAP offers innovative and effective programs developed and maintained with input from the people they served. Norris is a community partner of the Advocates in Medicine Pathway Program. Thank you all for being part of our Spotlight session today. I would now like to introduce today's facilitator, Dr. Amy Pernuski. Amy directs the Physicians in the Community course and the AMP programs at MCW-Central Wisconsin campus. Her research focus is community-engaged research and interventions designed to increase the participation of underrepresented students in science and medicine. Her initial training was in biomedical sciences from the University of Utah, and she completed additional training in evidence-based education, qualitative methods, and system-based assessment from the University of Wisconsin-Madison and Harvard Macy Institute. She is adept at designing and evaluating interventions and mentoring student-based research projects. Thank you, Amy, for serving as our facilitator today, and I now turn it over to you.
Great. Thanks so much, Stacy and Kelsey, for having our group here to join and share about some of the partnerships we've been able to form in Central Wisconsin. Again, I think most people are familiar that MCW-Central Wisconsin came into existence in 2016, and we quickly realized kind of the importance of having and building community partnerships. And one great example of the community partnerships we've been able to form is highlighted by the AMP program. So I'm really excited to have our guest panelists joining us today and giving them each a little bit of an opportunity to share about how their organization is able to contribute to this work through this program. So I'm going to start with Sheng Khang, who you heard a little bit of the biography on, and Sheng's going to share a few slides to give us a little bit of a overview of the AMP program and, again, sort of her passion and interest in being involved in this work. We also said we were going to do an icebreaker, so Sheng's also going to share with us her favorite sandwich.
Yes, can't forget about the sandwich. I'm Hmong, my background, and for us, we don't have a sandwich in our culture, but I do like the Vietnamese sandwich called banh mi. And what I did was I actually searched it up online so that I can provide a visual for everyone. And with the sandwich, we actually catered from a local restaurant with our first cycle and provided a sandwich for our first cycle and the staff to try. So yeah, that's my favorite sandwich. Should I popcorn to other individuals?
Yeah, why don't you head over to Paul next? Paul.
Yeah.
Prompt you with this.
Just my sandwich?
Yeah, your favorite sandwich.
Yeah, okay. So this is gonna be a really weird one, but I did a 6-week bicycle camping trip where we had to carry, dry food, and one of our staples was instant hummus. It was powder that you just mix with water, and it makes a pretty nice hummus. And so we ate a lot of hummus sandwiches, but to mix it up, we would get fresh produce or whatever we could find at the convenience stores and gas stations. One of the weird combinations that we came up with that I really liked was green peppers, bananas, and hummus. Sounds really weird, but it was good.
Awesome.
Popcorn to, let's see, how about Emma?
Okay, so my favorite sandwich, I think, is just like a basic meat and cheese. I like chicken and pepper jack cheese a lot, but I think it needs a little bit of a crunch. So adding like Doritos on it, I think is really good.
We're getting very creative here. Thanks. So we'll come over to Norris next.
I like a lot of different sandwiches, but if I am craving something like a comfort food, I will choose a toasted peanut butter sandwich.
And I'm with Stacy. I'm a big grilled cheese fan, and I like it with this tomato soup where you can dip it in there. So awesome. All right. So we'll let Sheng do a little bit of the program overview for everybody. But again, there's a number of familiar friends and people on the call. And so we do really want to encourage people, if you have any questions that come up during the presentation, just to throw them in the chat, given that this format's a little bit more of a panel discussion.
Great, thank you. Slide beginning. Okay, so this presentation I will be giving is an overview about the AMP program. And with this presentation, my intention is to provide background information about the program and where our goals were when we developed this program. And so In addition to MCW-Central Wisconsin, North Central AHAC is based in Wausau in the Marathon County. I'm also live in this area. And so many of you may know that Central Wisconsin has predominantly Hmong and rural populations. Both of these populations are greatly underserved. In the whole United States, Wisconsin is ranked as the third highest state with the Hmong population at 50,000. And so kind of like what Dr. Amy said earlier, although the MCW-Central Wisconsin opened its door in 2016, even with these rates in terms of population and the needs in the area, there hasn't been a Hmong student that graduated from the campus. And so looking down at these stats, less than 5% of the medical student enrollment in 2017 are from a rural community. And then just to the point again, MCW hasn't graduated Hmong student yet. And so it was very crucial that a very targeted approach needed to develop. And that was when multiple organizations in the area came together to develop the Advocates in Medicine Pathway program in the summer of 2020, which, if you recall, was when I also joined North Central AHAC to coordinate this program. And so we wanted to give thanks to the Advancing Healthier Wisconsin Endowment. They gifted us a 4-year grant of $400,000 to run this program for 4 cycles. And we are currently in our 3rd cycle. In terms of partnerships, these are our partnerships. I don't have CAPS here, but CAPS will discuss about their organization in a couple minutes. But the MCW-Central Wisconsin, in terms of like the different components, each organizations offer different type of support. So MCW-Central Wisconsin is really where the students will receive like the mentorship with the directly with the current medical students as well as staff. They will also have like the exposure to like the medical school setting. That way they become familiar with the campus and can envision themselves down the road when they're graduate from this program, as well as when they're done with their undergrad, that this is a setting that they also belong to. And so our intention again is to build the students' confidence. In terms of North Central AHAC, this is where I'm affiliated with, and this is where we provide the support through the advising sessions. And these are advising sessions that takes place between January through May. And actually through the end of July, if you think about like the community health internship program. And then with the UW-Stevens Point at Wausau, this campus provides the education and training in terms of like the community needs and the pressing issues related to health. And that's with Dr. Paul Whitaker. So he'll discuss about this later on. And then we added on Dr. Kevin Tao last year, but this year I want to say that we have a more robust clinical shadowing program where all 10 of our students are going to be secure with the clinical shadowing. And then we discussed the different components already, but I wanted to share that when the components were developed, we are very conscious about what does a medical student require in terms of like them getting admitted into medical school. And so we built the 7-month-long program around the AAMC's 15 core competencies of entering medical students. And so as you can see here, they are broken up into 4 different categories, and which each of these components, they fulfill each of these categories. And so I won't go too much details into the advising sessions, but with these sessions, our intention was to allow the students to practice skill sets and develop their skill sets that they would need. Sometimes it can be like maybe it's exposure to MCAT and how to better study for MCAT. Sometimes it's mock interviews where they have opportunities to be questioned, a potential question that would be asked during an interview admission process, so that they can get early exposure into that type of setting and question and brainstorm how to respond to those questions. And then there's a 1-week clinical shadowing. This range somewhere between 20 to 40 hours a week, depending on the preceptors and the students' availability and also like capacity. And then the 8 weeks on-site clinical, 8 weeks community health internship program. With this program, we are conscious as the students that we're recruiting from are from rural and Hmong backgrounds. And so they have financial barriers. So we want to make sure that this commitment is not an additional financial stress to them. So with this opportunity, we compensate the students' commitment at $4,800. In previous cycles, the stipend was $2,800. Let's see here. And then, like I said before, Paul will talk about the Wicked Problems in Medicine course. And then I didn't mention this on the slide, but then I wanted to share that the 5th component of the program is that the students in our program would have ample and abundance opportunity to network with the current medical students, as well as staff and the clinical preceptors. So that way they can establish lifelong mentorship with these different individuals. Again, just to build the students' confidence and also make sure that they're prepared to enter medical school. And then I've discussed the different benefits already, but I will highlight some of them. And the first one I want to highlight is that again, with our intention to facilitate the students into a medical degree program, we were able to secure a pilot opportunity for students to directly interview with the Central Wisconsin campus. So far, we have had 3 students that have taken advantage of this opportunity. 2 of these students were admitted into the program, were admitted to campus. They have not yet secure and make decisions yet, but they were admitted to this campus. 1 student is awaiting the status of their application. We do have other students who have reached out to us for this direct interview through a letter of recommendation process. So we will eventually have future, or our hope is to eventually have future MCW-Central Wisconsin cohorts that have AMP students in them. And then again, thinking about exposing students and getting them a head start, just because they have multiple barriers that maybe you're more affluent students who are more familiar with the medical application process. We want to make sure that we expose students to a similar application cycle. So with our program, when we recruit students, we have an application cycle, interview cycle, selection cycle, and then as well as a onboarding cohort, similar to medical students when they onboard students as well. And then we have provided, or we provide at least up to $1,000 in scholarships for students. And this is financial scholarship for students, so that if they are interested and need to use it toward an MCAT prep test course, they can use this toward that to help them prepare for the MCAT, so that at the end, or after they take the MCAT, or as they're working toward the MCAT, they can obtain a desirable MCAT score. We also have assisted students with technology needs, travel assistance, such as mileage, lodging, and then last but not least, we have also assisted students with conference registration and that type of different professional development, so that, again, we want to make sure students have these opportunities to add to their resume, so that they stand out amongst their peers. And then I'm going to hand it over to Dr. Amy to discuss what our letter recommendation process looked like.
Yeah, so there are actually a number of people on the call that helped make this happen. So again, besides just having our community partnerships, I think this program's really also been successful through partnerships we've been able to form at MCW. And so that was including a close partnership with the admissions committee process that would then allow us to have the students get bypass sort of the primary screening process and be able to then, because we have a close relationship with the students and they're able to meet certain criteria, that they are able to get the direct interview option. So again, this is something that we've been piloting for this year. And again, are appreciative of, the admissions group also being open to thinking through what would be some strategies to reduce barriers for students from these backgrounds. And then the one other MCW partnership that I think AMP has also benefited from is that a number of the pipeline programs have been really trying to coordinate their efforts a little bit more. And so this includes having shared recruitment pages, highlighting the different programs and search options. And then and Crystal Jushka has been helping to lead some of those efforts, as well as exploring opportunities to build some dashboards and things like that. So I think just being able to have some of that synergy across MCW's programs is another benefit that we've had as we've started the program.
I wanted to just backtrack quickly in terms of like the benefits. I forgot to highlight that UW-Stevens Point at Wausau Foundation has been also very supportive with the 1 credit course at the campus. They have provided financial assistance for all of the students, so they didn't have to pay out of pocket for the course. Oh, Amy, do you want to say something?
Oh, I was just going to say, so I see, because again, we want this to be a little bit more conversational than just a presentation. So I'm seeing that Marcia's putting something in the chat, again, being from kind of that rural background and how it can be challenging to have mentors and contacts. And again, Emma, as having been a program participant, do you want to comment on that a little bit too, on kind of how you benefited from, being able to have some of that mentorship and build some of that confidence for being able to reach out to people?
Yeah, I can comment on that. So I live in rural Wisconsin right now, but I went to high school and part of middle school in a very rural town in Wyoming. So I didn't really have much support in both of those areas. And I don't have any family members that are doctors. So, I didn't know how the medical application process really went. But that's the reason I applied for AMP, is because I really wanted some guidance. But I came out with that with a lot more. I got, friends and mentors, and I gained, as Amy said, a lot of confidence in myself and in my rural background, and how I could use my background as a kind of like benefit rather than a hindrance. So AMP was, very helpful to me, and I'm so grateful for all of them, which is part of the reason I decided that I wanted to become a near-peer mentor as well, so I could help others like I was helped during my cohort.
Awesome. So I think that leads in pretty nicely. Sheng was showing maybe a little bit about the snapshots of the cohorts.
Yeah, so these are the snapshots of the previous cohorts. As you can see in the far left here, this is the first cohort. We were able to recruit 10 students across Wisconsin here. We have 1 student from the state of Minnesota, and that's just to show that this program is not limited to just Wisconsin. And just to go back to like the goal, we do want to stay with our goals, such as like recruiting students from Hmong and rural background, but we realized that because of the pandemic, we were limited to our recruiting efforts and our reach. So that's why we opened it up to multiple states. But I won't go into too much detail, but this, like I said, this left side here is the first cohort. The second side here, right side here is a second cohort. And then I'll move on to the third cohort. This is our current cohort. Right now they are in the, they already completed the advising sessions, and they are in the Wicked Problems in Medicine's course. So yeah, this is our third cohort. Oops. All right, so in terms of like our cohort, this data is based in fall 2022 collection. Our students in the first cohort, some of them are still pursuing their undergrad degree, trying to build their medical application. Some of them are for our second cohort, mid-in school program, and in terms of like the second cohort, we still have students who are still pursuing their undergrad degree. And then we have had a couple students who have went on to work at the clinic that they shadow at. Emma didn't mention this earlier, but her preceptor is someone that she's working with at the moment. So that's great that we were able to establish these connections for students like Emma. Oops. All right, so I'll cover like the Wisconsin North Central AHEC support and resources. In addition to like community health internship program through the AMP program, we also have these three programs that students can get involved in. There's a scholars program, which is a 2 years commitment that students can get can participate in. They offer, there is a small stipend students receive while in this program. Community health immersion, this is a 2 to 3 days program where students are immersed in like certain regional communities to learn about the needs of that community. And then I'm sure you guys have seen that we mentioned MCAT assistance and prep in the previous slides. And so with that MCAT prep, what we do is we were able to establish a connection with their Princeton Review and secure discount rates for some of our students. So many of our students have taken advantage of that. Okay. All right.
So Sheng, you probably stop sharing with the slides, but we did have a question from Kelsey about what are the current recruiting strategies for the program? And again, maybe even sharing the timing, because we're hoping people on the call might be able to help with recruitment.
So yeah, so in terms of like recruiting, with the first cycle, we didn't receive the grant until July. And so we really had like a very short recruiting cycle. So it went through like the end of October, I believe. But with our grant that we were able to receive, we did gain national attention from Hmong communities across the United States. I have individuals reaching out to me from California, Oklahoma, those type of like communities where there's a high Hmong population in. And in terms of like how these areas hear about AMP is through like the grant that we received. And so there was a WPR radio show that Dr. Corey was part of, and so that got national attention. And then with the Hmong population, we don't really have like a centralized news station or anything that we listen to. And so for us, we get most of our information through social media, especially on Facebook. And so what we did was we posted the flyer on social media and also reach out to local partners to share about the community. About the program, I'm sorry. And then for current recruiting strategies, we're using social medias and also words of mouth. Not sure you guys were able to catch this, but we have students from UW-Oshkosh in the first cycle and a second cycle. We have students from UW-Eau Claire in the first cycle and as well as second cycle.
Yeah, and I threw the web page in there too, because that's where we usually post the application. And we have a really nice video that Laura Hunt from our community helped us make too to help with the recruitment. So, but again, hope people on the call will also be able to help identify individuals that might be good candidates. And the applications usually open up in the summer, and the deadline is November for that. So. All right, so at this point, we wanted to hear a little bit more from Paul Whitaker about kind of our partnership with UW-Stevens Point at Wausau and the course that he helps lead.
Yeah, all right. So the course, the Wicked Problems in Medicine course, is a 1-credit course that meets for 15 hours, either first 2 go-rounds. We met 1 hour a week in the evening by Zoom virtually. This semester, we switched to having our mentoring sessions be the first half of the semester. So the class meets 2 hours on Wednesday evenings for the second half of the semester. And actually right after this program, I'll be jumping right into the class this evening. We meet at 5 o'clock. The class is kind of structured based on some one-credit special topics honors seminars that I had taught for years here at our 2-year campus in Wausau, where there were readings. Students would do some written answers to questions about the readings before class, and then we would get together and kind of talk through it. So it was a reading, writing, and discussion-based class. Often the readings for those classes and for this are pushing, I think, the intellectual envelope for the students, kind of challenging them into new territory. The Wicked Problems title is one that we all came up with. I see the peanut butter and banana sandwich. Is the Wicked Problems title comes from the idea that that many problems in medicine are multifaceted, difficult to diagnose. Problems often have multiple causes, some of which are kind of biological or physical. Many of them are environmental, and then there are also many social determinants of health. And so kind of helping students that are interested in medicine wrap their minds around the complexity of medical problems, that diagnosis and treatment is often a really complicated task. The first 2 years, we had the students read a book called Drug Dealer MD about sort of the origins and causes of the opioid epidemic that is just rampant in the United States right now. And we were fortunate that the author of the book, a professor at Stanford University, was willing to join us live via Zoom for both class times. And she was incredibly gracious and forthright and honest. And the students, I think, were really honored to have her with us. This year, we sort of switched gears a little bit, or actually quite a bit, and we are using 2 adapted case studies very similar to the ones that medical students at MCW are using. So we're looking, the first one was a case on diabetes in a Hmong individual. And so we looked at sort of cultural aspects of medicine and primary care. And the second case that we'll be starting into this evening is on dementia and Alzheimer's. And that brings in issues of caregiver burnout and community resource availability and those kinds of things. And both of these are chronic diseases where there's no cure. So it's kind of a lifetime commitment to treatment, care, and disease management. So that's kind of a synopsis of the Wicked Problems course.
Yeah, thanks, Paul. And a number of the people on the call too know one of my other roles is with our launch of the MCW Fusion curriculum and doing this patient-based discussion format. And so that's part of what Paul is using for the course, is kind of a similar format for these students so they can get really comfortable with that process that they would need to use in medical school. So I guess one more follow-up question for you, Paul, is so can you elaborate a little bit more on what do you see as some of the benefits of UW-Stevens Point at Wausau collaborating with MCW?
Yes, I can. And actually, I just got a letter of recommendation request for a former student that wants to go to medical school, and she took some classes with me back in 2018 and 19. And so I want to read just an excerpt from her email that she sent me. I just got this on Tuesday, yesterday. She says, "I hope this email finds you well. I had the pleasure of taking classes from you during my time at UWMC, which is now UWSP Wausau, and attest that you were my favorite bioscience professor of my undergraduate career. I've always been grateful for the simple ways you made science fun." She transferred to the University of Minnesota, and she in parentheses says, "as the UMN was not this kind," and for the letter of recommendation you authored for my admissions into the University of Minnesota. Her time there was cut short due to the pandemic, which made creating meaningful relationships with professors difficult. It was at this time that I remembered your story about students coming back to ask for letters of recommendation from you years later. And so that's something that happens quite frequently at a small campus like the Wausau campus, where our classes are small. And so I get to know all of the students by first name basis very early in the semester, and get to know them pretty well and remember them. So you can write really tailored letters of recommendation. My own son went to came here to this campus and then went to Madison. And even as a junior and senior, was taking human physiology with 300 other students and went to office hours every week. And the office hours were 40 students in a classroom. So I never got to know his faculty. very well. So I think one of the big deals here, one of the big advantages of this partnership is that the students are taking this class in a small class size. It's intimate, which really lends itself well to that discussion and writing and sort of critical evaluation and grading of writing and that feedback. The class benefits greatly from the partnership with MCW in terms of just course content and connections and relationships and guest speakers and bringing in community resources that I might not be aware of or have access to. So it winds up, I hope, being a very rich experience for the students that go through the course, even though it's brief, right? I mean, this semester it's 7 weeks and it's only a 1-credit course, but I hope it's a rich and valuable learning experience for the students.
Awesome. Thanks, Paul. And I also want to really give a shout out to Paul and to Chris Prawl, who has also helped teach this course. And again, they teach the course for us, but they're integral planning partners for us for the program. They attend our weekly planning meetings so that we can really make sure that we're coordinating efforts, and Paul's helped interview people or the applicants and things. And so again, just really appreciate all his time and effort that's gone into making this program a success. So I will hand it next over to Norris, who's going to tell us a little bit more about one of the community health internship program sites that has taken the AMP students for the past few years. And so excited to learn a little bit more about her organization and partnership with AMP.
Yes, thank you so much for having me here. I'm sharing a little bit more about our organization and the great work we have been receiving from the interns in the past 2 years. CAP Services is one of 16 community action agencies in the state of Wisconsin. And community action agencies were funded back in 1966 by President Lyndon Johnson to in this project to fight poverty. So we are given federal funds, community foundation funds, private funds to have several programs that, as we can see in these interconnected circles graphic that you see, are components to fight against poverty. And we are not an organization that provides direct health services, but as we can see poverty as one of the social determinants of health, interns have gained some experience, hands-on experience on that. So we have a lot of different programs, and our mission is to transform people and get them to get self-sufficient. So we have programs on the job skills and economic security component. We have on the business coaching and lending component, community and real estate development, housing and transportation, child and family development, health, wellness, and safety, and advocacy and community engagement. We have a program on the job skills. It's called Skills Enhancement Program, and the program provides some payment for tuition, childcare, books, mileage, so people can get better pay. We have business coaching. If a person has an idea of a small business, they just need to come to us and we will guide them through their business plan and lenders, or even if they qualify, they can apply for a loan with us. We have some on the community and real estate development. We have some rental units, income-based units, and also for seniors. We have a program that provides all these programs are income eligible, but we can provide down payment for buying a house. We can, there's a program called Housing Stability right now that assist clients, community members to utilize resources out there in the community so they can, we all know that housing is a real crisis right now. So we guide our community members to utilize or leverage all the resources that are available, so they can use the money they have or they gain towards housing. So instead of paying for medical bills, we guide them through how to get the best medical resources and how to apply for foundations to pay their bills and things like this, so they can put that money towards housing, because there are no good housing programs at the moment. We were having a rental assistance, emergency rental assistance through some COVID funds, but the program stopped. The government ran out of that funding. So there is a huge housing crisis out there. We have a program for in the component of transportation that can provide a loan for up to $5,000 for a reliable car, 0 interest for people to get to work. And we have another program that you can get up to $10,000 for a car, but it has some interest on that, because we all know with the market, it's hard to find a good, reliable car for $5,000. Then we have Head Start, Early Head Start, child care services, family resource centers that provide these child and family development program. In the Portage County area, we have a unique program that we don't have in the other counties, that is called Hmong Uplift. It's a family literacy program for Hmong families, and we work directly associated with the school districts, and they give us referrals for kids that need a little bit more of support. And so we work with the family together. We have case managers that work with the parents, and they work along with as they work with the kiddos. So they, while the parents are learning English or earning a certificate, in the same room, the kids are going to be doing homework, and everybody's going to be interchanging some education time. And the requirements for the main requirement for that program is that one of the parents want to improve their education or their wages through work. Then on the health, wellness, and safety, we have our Family Crisis Center that provides domestic violence and sexual assault advocates and shelter. We also have a Mental Health Navigator that is a program that is growing a lot as our mental health issues around the country and our state are growing. We have 24-hour line that can provide resources. We don't have the person who answers the phone are not counselors, but they provide referrals to resources, and they have in-person advocates schools in Portage and Wapaka County. So kids approach our advocates to ask for resources on their own. And lastly, we have the advocacy and community engagement component that I am the coordinator on that component. And well, on advocacy, we have a program called the Poverty Simulation. If you have not heard of it, it's an experience that you participate in to live in simulated life of a people experiencing poverty. So you need to get to the end of your month that is simulated in 2 hours and keep housing and feed your kids. So it is a really interesting program that if you have not experienced it, I will advise you to pursue it. You just can contact me through CAP services and we will provide the kids and the facilitators. It is a very interesting program. Families, participants need to go through different agencies to make to gain information on programs and participate. They need to register for food share, and they need to register kids for school, and they need to pay their mortgage. And so it is a very interesting, and at the end, when the most important part of the experience is the debrief. And when people understand that I didn't know this was going to be so hard. I didn't know that people experience these kind of things. Oh, now I know why they couldn't get to the parent-teacher conference and things like this, things that sometimes we don't realize, or people who have not experienced poverty don't realize. So, and then on the advocacy and community engagement, we have our community resource team that is the team where the interns have been participating, and we do outreach, we provide resources to the community. And within the last 2 years that we have been participating with the AMP and the AHEC program, it's been eye-opening for the students. And so benefits for us, we increase staff capacity, because as a nonprofit, you might know we are always short of staff, short of funding. So staff capacity is a plus. We got external fresh eyes on problems that sometimes we don't even see, but students come with these fresh brains, and they can see solutions, and they can see also, they can identify challenges. And these last 2 years have been great, amazing, and they have brought skills and knowledge to share with us. One of our the first intern, he worked developing a survey to clients that were receiving Wisconsin emergency rental assistance in order to identify potential process improvements. This is something that we didn't have the capacity to do. We didn't have time, staff to do, and he did it. So he helped us identify what, with his fresh eyes, what was not being done good on behalf of the client. What could be done better? We were just like in surviving mode with all these clients asking for emergency rental assistance, and every minute of the day, and just following some processes that we created, like an emergency as COVID came to us, right? He also helped us. This community resource team is a new team of CAP services, and he helped us develop through some brainstorming to create our shared purpose. As I said, when we were in this crisis mode, working with clients who also were suffering some financial crisis, sometimes we got so burnt out and like you cannot see more. And as the coordinator of the team, I said, hey, let's step back a little bit and see why are we here. So we created that couple of brainstorm sessions, and he was part of it, and he gave us a lot of insights, and it was a great experience for both. And on the second year, our intern helped us develop our directory of resources, and within these 2 years, they have I would say that they gained exposure to issues they might have not been aware of. They also gained different skills. I remember at the first year, of course, you're fresh from college and you have all this technology experience and skills, and we were working just with Google Docs. And he said, oh, I needed to learn Google Docs in order to work with you. And so we don't have fancy data software. We just work on Excel docs because we're a nonprofit. So they get to witness that side of nonprofit work and see nonprofit work as through a different lens, and how dynamic and fluid the work can be, and how that can affect our clients, and how and why it's a cycle. And also they gain a lot of relationships through the work, relationship building skills, working with community members directly. So I think the takeaways, and I'm gonna read verbatim from their post-internship conversations. One of them said it was an open eyes on how people who don't know how to get resources get lost in the system. And the other one said, I had the chance to experience the behind the scenes, there is a lot of what the organization does. There are so many challenges in the field: funding, staff capacity, compassion, burnout. So there's a lot. I'm so grateful for our past interns, and we're going for our 3rd year.
Great. Thanks so much, Norris. I think you did an excellent job sort of highlighting the benefits to both your organization of having the AMP students there, and then like all these really important skills that the students are also going to be taking away in terms of networking and being aware of those resources. And, you know, one of our central tenets at MCW-Central Wisconsin is to be community engaged. And, you know, one of my roles is directing the Physician in the Community course. And so by having this CHIP internship, you know, these are really skills that we do want the students to have as they would be coming into med school. So Jay's got the slides that we're wrapping up, but I did want to let Emma kind of have one last comment here, again, as a program participant, kind of on her perspective of the value of the program.
Yeah, I can just talk real fast about my CHIP experience. I did my CHIP experience at the neighbor's place in Wausau. I did a bunch of different things. I volunteered in their food pantry. I kind of surveyed members of the community and their struggles with eating healthy. And then my main project was creating a recipe book with all the different fruits and vegetables to help these food pantry users make easy recipes with kind of weird and exotic fruits and vegetables. And while I was at the food pantry at the neighbor's place, I really learned the role of food pantries in the community and the amount of work and manpower that is involved to make the food pantry run smoothly. On pantry days, the warehouse was always full of volunteers, and just, bagging the produce, working the assembly line, getting the boxes out to the individuals' cars, and then also weeding and mowing our community garden. And then there's a bunch of behind the scenes manpower that also goes into the food pantry to make everything run smoothly. So while at the neighbor's place, I learned the high percentage of individuals who struggle to use healthy and fresh ingredients in their daily meals, not because they don't want to, but simply because they're restricted, whether that's financially or because they don't have a car or access. So then for me, being an aspiring physician, my CHIP internship helped strengthen my belief in the importance of being immersed in the community and made me want to become an advocate for those struggling with healthier meals and find ways to have fresh produce more accessible to all.
Awesome. Thanks, Emma. Well, I'll just wrap things up at this point. Again, we really thank everybody for joining us. And I particularly thank all the panelists for their commitment to the program. As Stacy put in the chat, I know there'll be a follow-up evaluation, and it looks like there's a great upcoming event here in May as well.
Great. Thanks so much, Dr. Panuski, and to Emma, and to Nerys, to Sheng, and to Paul. Thanks so much for joining us, and hope to see you next month. Have a wonderful evening, everybody.